You can start, Dr. Hartle.
All right, thank you. Hello and welcome. My name is Roger Hartle, and I'm your host today. I'm the neurosurgical director of neurosurgery spine at Weill, Cornell, and Ox Spine here in New York City. Together with Ricky Singh, Neil Mehta, and Josh Weaver, I'm also one of the co-directors of the Center for Comprehensive Spine Care on 59th Street and 2nd Avenue. Today, I want to talk a little bit about the Spine Center that most of you probably know about, and then I'll introduce the speakers and the topic. As you know, we're located on 59th Street and 2nd Avenue. The Spine Center brings together a variety of specialties that all focus on spine problems. We have neurosurgeons, we have orthopedic spine surgeons, but even more important, we have pain management, rehabilitation medicine, complementary medicine, integrative health, and all these specialties work together very, very closely to diagnose your spine problem, then obviously to treat it and lead you through recovery to a healthy and hopefully normal and happy life. Now, every 2 weeks, we've been doing these Spine Time webinars. And today, we're very, very excited to talk about nutrition because we know that everybody who has spine issues depends on healthy nutrition, and there's a big impact of how you eat and how you drink on how your spine behaves and how you feel as a spine patient. We have Mark Hyman here, who many of you know, of course. Mark is a specialist in functional medicine. He's a graduate originally from Cornell University, which we're very happy about. He got his medical degree in Canada, University of Ottawa, correct?
Yes,
and
I did.
Practiced in family medicine for many years. Became really interested and fascinated by nutrition and nutrition-related health aspects and functional medicine. And I'm sure he's going to tell us a little bit more about functional medicine, what that is and what that means. But since 2014, you have been the director of functional medicine at the Cleveland Clinic Center for Functional Medicine. Obviously a best-selling author. I think you have 11 best-selling books.
14.
Which,
14.
I'm sorry, 14.
There's been a few more since I saw you.
Right, yeah. So my information is like a year old. So in 1 year, 3 more books. A very successful podcast that I've been listening to many times, Doctor's Pharmacy.
Oh, wow.
And then the director for the Center for the Ultra Wellness Center. I'm sure you'll tell us a little bit about that. But he's only one guest. We have 2 guests today. The second guest is one of my favorite doctors here in the Spine Center, one of my co-directors for the Center for Comprehensive Spine Care, Ricky Singh. Many of you know him, of course. He's the director of interventional spine and rehabilitation medicine at Weill Cornell. The goal today is to talk about nutrition and how nutrition affects spine health. And we want to keep it conversational. At the same time, though, we thought it would be good to maybe get started with a short primer. And I'll ask Ricky maybe to talk a few minutes about inflammation and some of the basic aspects of nutrition. And then we'll hand it over to Mark. And then from there, we'll go back and forth. And hopefully, feel free to send in questions, comments. We'll try to address many of those, of course. But let's get started, Ricky.
Appreciate it. Thanks, Roger. Dr. Hyman, pleasure to see you. Very excited about this talk. Something that we should do more in our interactions with patients is talk about some of these modifiable risk factors, such as diet, nutrition. We do a decent amount with exercise, but I think this is a great topic. We're going to have a lot of good engagement here. And the reason we talk about diet and the reason patients come to see us is because of inflammation, and how do we control inflammation in the body? Some of it's not necessarily bad. When there's an injury, the body mounts an acute inflammatory response, which is good. It protects the body. It sends cells to where that healing needs to occur. And when that healing is done, inflammation should go away. What happens sometimes is this acute inflammation turns into chronic. And that's when the body continues to send these inflammatory cells. And it not only heals the bad tissue, but it also kind of destroys or damages healthy organs and healthy cells. And this we know can lead to a number of chronic diseases that many, many people, especially in America, suffer from: heart disease, cancer, GI disturbances, and arthritis and spine pain, which is what we tend to treat here at the Comprehensive Spine Center. There have been many papers that talk about diet and back pain. We know that if you are out there eating a more an anti-inflammatory diet, you tend to have a somewhat protection of back pain. And conversely, if you're one of those people who eat a pro-inflammatory diet, you're 42% more likely to have back pain in your lifetime. So what are some of those options? What are anti-inflammatory versus pro-inflammatory? So the pro-inflammatory diet is consistent with what we eat in America, sadly, right? It's called the SAD diet, Standard American Diet. Very high in sodas, very high in fruit juices and trans fats. And we're going to learn today how we can avoid some of these items and what things we should eat in the body. Whereas an anti-inflammatory diet is what we tell our kids, right? Eat the rainbow, eat all the colorful fruits and vegetables, eat legumes and good fats, omega-3 versus omega-6. I hope we talk about that with Dr. Hyman today. And then a lot of anti-inflammatory spices. You know, in Indian food, we cook a lot with curcumin or turmeric, which has been shown to lead to an anti-inflammatory state, help with conditions such as neurodegenerative conditions like Alzheimer's and even Parkinson's, but it's also been shown to help with heart disease and joint inflammation. So the big question that we have out there, that I have for Dr. Hyman, which is the next slide, is what the heck should we eat? And you have written an excellent book on that. We have read it here. Dr. Roger Hartle and I have been reviewing it today.
Oh boy.
That's why we're here to discuss this. So Dr. Hyman, what should we eat?
Thank you so much, Ricky and Dr. Hartle. For those of you listening, I was actually a patient of Dr. Hartle. He fixed my back, and we became friends. And I think that there's a real opportunity in medicine to reevaluate our approach to nutrition, because what most of us in medical school never learned was how to teach our patients to eat to promote health. And the truth is that most chronic disease is caused by food and also can be cured by food. And yet we learn very little about it. So the whole idea is to actually reimagine what food is and try to understand it from perspective, not just of calories, but as a tool for healing. So next slide. There's a joke. There's a new drug that's been around and just kind of available now, which has the power to improve the expression of tens of thousands of genes, to optimize tens of thousands of protein networks, to optimize your immune system, to improve your microbiome, to normalize your brain chemistry. And it works faster, better, and cheaper than any drug on the planet. And it's available to pretty much almost everyone. And guess what it is? Next slide. It's basically food. So what I would say is what you put at the end of your fork is far more powerful than what you'll find in a prescription bottle. And I think combining optimal nutrition with spine care and surgery is just such a win-win situation, because so many of us are burdened by poor health and poor diet. Next slide. So the whole idea is that food is far more than calories. Calories it is for sure. And most of us in medical school learn that weight loss is really just about calories in, calories out. If you eat less and exercise more, you're going to succeed. And that whole idea has been completely debunked, because food is far more than just calories. Yes, there's calories, but there's also protein, fat, carbohydrates, fiber, phytochemicals. There's DNA of food in there. There's all sorts of molecules that we are consuming every day that are regulating our biology in real time. And so when you think about eating, it's not just eating for energy, it's eating for creating a different software upgrade to your biology. Next slide. So when you think about food, it really should be thought of as code, as literally code that upgrades or downgrades your biological software with every bite. It's information, it's not just calories. And that means that what you eat matters, the quality matters. So protein is not protein, carbs are not carbs, fat's not fat. You can eat trans fat, as Ricky was talking about, which is harmful, causes heart disease and inflammation, or you can do omega-3 fats, which are anti-inflammatory, healing, and reparative. You could eat gram for gram of the same fat, has profoundly different effects on your biology. You could eat, for example, a carbohydrate that comes from white flour, or you could eat a carbohydrate that comes from broccoli, and they have profoundly different effects on the biology in terms of upgrading or downgrading your health, particularly around inflammation. Next slide. So the question really is, what should we eat? A paleo vegan conversation is really a part of this whole diet wars, diet controversies. And I kind of jokingly came up with this concept called a PEGAN diet, which is basically a spoof on the diet wars and extremes. Say, like, what do we know about food? And it should essentially be focused on a few things. One is we should think about food as information and medicine. Whenever you're taking a bite of everything, is it something that's either harming or hurting you? And there's some real simple ways to figure that out. Two, food is medicine. So quality matters. So the quality is really key. And the focus on quality is so important, because when I say quality, I mean nutrient density. For example, white flour has a lot of problems. Wheat is hybridized, it's dwarf wheat. It's sprayed with glyphosate at harvest, which destroys your microbiome, can cause cancer. It's got way more gluten proteins in it, which is why people are gluten intolerant. It's also preserved with calcium propionate, which is causes neurologic cognitive issues and behavioral issues in kids. And it also has a super starch called amylpectinase, so it raises your blood sugar more than table sugar. That's flour. You can have pancakes from that, or you can have pancakes from Himalayan buckwheat flour that has 132 phytochemicals, things like quercetin, rutin, spiridin, all these bioflavonoids and other phytochemicals that regulate your immune system, that has much protein, more minerals, less glycemic load, more fiber, microbiome supporting fibers. Same thing as flour, right? Gram for gram, pancakes, but profoundly different effects on your biology. So let's kind of go to the next slide. So this is kind of simple principles, and then we'll open it up for questions. The simple principles are, how do you eat in a way that upgrades your biology? That's anti-inflammatory, that's reparative, regenerative, that heals your microbiome, that optimizes your mitochondria, which is your energy factories, improves your brain chemistry, that helps your metabolism work properly, that promotes longevity and health. And I sort of summed it up in a few principles. Next slide, please. So the first principle is really that, this is complicated. So you're probably wondering why there's so much controversy about nutrition, and why can't everybody agree? It's because most of the research is really done in a way that looks at large populations over time, and it's hard to make conclusions. So it's like, okay, you take 10,000 people or 100,000 people, you follow them for 30 years, and once a year you give them a question, you say, what did you eat last week? So I'm talking to you right now, there's 155 people listening. What did you have for lunch last Thursday? Can you tell me? I bet you can't, right? So that's a very kind of poor way of determining someone's nutrition over a long period of time. It's the best we got, but it kind of sucks. And you can come to very wrong conclusions. And the Nurses' Health Study, for example, showed that all women should be taking hormones to prevent heart disease, cancer, and then that was pushed on the population, and 50 million people were taking Premarin. And then the Women's Health Initiative, which is a randomized controlled trial, which is an actual experiment, gave half women hormones and half women not, and they found the women who took the hormones actually did a lot worse. So you really, it's a problem. Next slide. So the key here is what should we be eating? What are the principles? One, it should be very low glycemic. So one of the things that is the problematic factor with our diet is that 60% of the food we eat is from ultra processed, high carbohydrate foods, starch and sugar. That's an enormous amount of sugar. We eat 152 pounds of sugar a year, 133 pounds of flour per person per year. That's almost a pound a day. That's deadly. We've never been evolved to eat that. And sugar and starch drive inflammation. They drive every age-related disease, cancer, heart disease, diabetes, dementia, and also orthopedic issues, arthritis, inflammation. It just creates inflammation throughout your body. So your diet is the biggest tool you have to drive inflammation up or down. And sugar is the biggest thing that drives inflammation. The second is we should be eating rainbow color foods. Why? Because there's 25,000 phytochemicals in the plant kingdom, many of which are anti-inflammatory. You've heard of some like turmeric or curcumin. But so many of these polyphenols and bioflavonoids and phenolics in the plants, these phytochemicals, really are powerful anti-inflammatories and antioxidants. So we just eat the rainbow. Second is if we're eating fruit, it's fine, but stay away from things like grapes and bananas and pineapple, high sugar. Stick with more lower glycemic fruits like berries and kiwis and apples. Also fat. Fat is not the enemy. In fact, it's actually helpful for so many things. So lots of omega-3 fats from fatty fish like sardines, herring, mackerel, small fish, stay away from the tuna, swordfish. Omega-3 fats are critical for regulating inflammation. And we typically in this country have about 10% of our calories from seed oils that come from like soybean oil, 10%, which is 1,000-fold increase, and that drives inflammation. We never really evolved to eat that much. We ate it in nuts and seeds, we eat beans or whatever, we get it, but it wasn't in the volume we eat it. Olive oil is also very anti-inflammatory. There's actually even oleocanthal in olive oil that actually can be antiviral, and it's been shown effective against virus, which is good during COVID. And of course, nuts and seeds are great sources of fats, avocados and so forth. Low in refined oils, Ricky talked a little bit about that. And dairy is a complicated one. Most of the dairy we eat in this country is from factory farms, hormones, antibiotics, milking pregnant cows, getting lots more hormones. And also it can be very inflammatory for some people. So without getting too far into it, goat and sheep are better because they have a different form of casein, which isn't as inflammatory. Next slide. And of course, this is ideal, but I can't always do it, but whole food, organic food, fresh food, the shortest distance from the farm to your fork. If you can recognize what it is, then eat it. If it's got 47 ingredients and you don't know what they are and you can't pronounce them, probably shouldn't eat it. If we're eating animal food, we want to eat really as close to nature as possible. And really exciting research is coming out now looking at regeneratively raised grass-fed animals and how they have very different effects on your biology than, for example, feedlot meat. In one study in Australia, they looked at kangaroo meat versus feedlot meat. The kangaroo meat gram per gram increased inflammation in the body. The kangaroo meat decreased inflammation in the body, and the feedlot meat increased inflammation in the body. So if you can eat, for example, grass-fed meats, I've been going online shopping at this thing called North Star Bison. You can buy venison, elk, and buffalo or bison. That's great. Fish, again, it's great, but low mercury fish, and that means the tuna, swordfish, halibut, those big fish you want to stay away from. The grains are okay, but they can be inflammatory for some people, and particularly starchy grains. So I would say stick with weird food like black rice, brown rice, quinoa, buckwheat. Those are fine. If you're eating gluten grains, stick with ones that are more traditional heirloom, like heirloom rye. I think Roger from Germany, right? So there's amazing breads that they have in Germany they don't have in America, where you need a meat slicer to cut the bread. Like everybody has this like deli slicer in their house where the bread is so thick you could stand on it and you can't actually make it squish because it's so thick, because it's made with whole grains. That's fine. Beans, again, are fine. And of course, you want to get rid of all the crap. I mean, nobody should be eating pesticides, antibiotics, hormones, additives. The average American eats about 3 pounds of additives, and they can cause a lot of damage. They cause leaky gut. They cause damage in your gut. And your microbiome, your gut, you're also eating not just for you, but you're eating for this whole other organ that's in you, which is the gut bacteria that's about 10 times as many cells as your cells, about 100 times as much DNA, and it's creating all these metabolites. So if you're feeding the good bugs by lots of fiber, lots of phytochemicals, probiotic foods, prebiotic foods, you're actually helping your gut heal and repair. If you eat all the American diet, we often get what we call leaky gut, or permeability increases in the gut, and that drives inflammation. That's one of the biggest drivers. So it's not just the food itself, but it's what it does to your gut and how it creates damage. So all of a sudden, it's like a coffee filter that's not working, and you're getting grounds in your coffee. And those grounds are the bacterial molecules, food proteins that cause systemic inflammation. And so we found, and particularly, when you see people who are unhealthy, overweight, when you do surgery on them, their tissues aren't healthy. It's hard to heal. It's hard to repair. Their nutritional status is low. So it's really important to optimize nutritional status through food, but also certain supplements like zinc, vitamin A, vitamin E, omega-3 fats are really helpful pre and post-op for surgery. Next slide. So basically, that's it. We should be eating real food.
Can I ask you a question, Dr. Hyman? One of the things that we focus on a lot here at the Spine Center is mobility. And as we age, obviously we know that muscle mass and lean muscle mass gets a little bit less. We want to prevent something called sarcopenia, which is the dense fibers in the muscle getting a little weaker, because we want patients to move. And, there's always a question of, do I need to eat meat? Do I need to eat animal protein to make my muscles stronger? There's a great documentary called Game Changers that looked at professional athletes, and even the strongest animals in the animal kingdom, like gorillas and bison, they're vegetarian. So can you comment a little bit about animal versus kind of plant protein on building muscle?
Yes, great question. Well, first of all, it was a great propaganda movie. I wouldn't say it was a great documentary.
Fair point.
Second, I would say gorillas eat all the friggin' day. Bison and big animals have multiple stomachs and basically have to eat all day long and have very different systems than ours. And yes, they can build muscle, but they actually have a very different digestive tract. So if we ate all day and we had like a bunch of stomachs, we probably could be fine. Here's the deal. When you look at the data, as we get older, like you said, we lose muscle. Muscle is the currency of health. It's the currency of healthy longevity. And when you see people as they get older, what they lose is functionality. They lose their ability to get out of a chair, to have their balance be good, to be stable, to do the things they want to do. And it's because even if you don't gain weight, you lose muscle. And the diet makes you lose muscle. Lack of exercise makes you lose muscle. Stress makes you lose muscle. So the diet that we're typically eating in America is a very high sugar inflammatory diet that drives the inflammatory process. And it causes the sarcopenia, which leads to low testosterone, low growth hormone, high cortisol, high blood sugar, high triglyceride. It just creates this whole metabolic disaster. So it's not just about being weak, it's about the metabolic aging consequences. So as we look at the data, plant protein versus, chicken versus fish versus meat, basically you need muscle to build muscle. You can get plant proteins that are jacked up with amino acids that are called branched chain amino acids like leucine, lysine. Leucine is the rate limiting amino acid for protein synthesis. So most plant proteins are very low in leucine, whereas animal proteins are higher in leucine. And if you get on a vegan diet, those guys, they have to be jacking up with all sorts of protein powders. They're not going to get like that just from eating beans and grains. They have to take high concentrations. I met these guys. They do eat a vegan diet, but they're also eating extraordinary amounts of basically highly processed plant proteins like pea protein or other proteins. And you can do it, and you can. And I mean, there's a protein called the Garden of Life Sport protein where they jack it up with all kinds of amino acids, so you can get there. But for most people, as we age, we really do need more protein, and we need more high quality protein. And when you look at muscle synthesis, meat is the best, chicken, fish, and then plant proteins. And if you want to eat plant proteins, if you supplement with a little animal protein, you can be great. I use, for example, goat whey because I tolerate it well. It's a great muscle building protein. It's really, it has very little taste. So I really like that. And I tend to eat more things like elk and bison and venison and, grass-fed meats. And I think I found that as I've gotten older, and you can look at my Instagram, I used to eat a lot more carbohydrates, but I basically, over the last year or two, I've been doing my weights since I had my back surgery, and my body's completely changed. And I look completely different and have way more muscle mass because of that. So I think, despite the fact that, there's an aspirational idea that veganism is the best diet, it really isn't for most people. And there's a lot of nutritional issues that happen, particularly as you get older or you're on it a long time. And the truth is, anybody switching from a traditional American diet, which is mostly junk and processed food, to a plant food diet, a vegan diet, will get better. The question is what happens over time. And you see often loss of muscle and nutritional deficiencies.
One last question for me, Roger, before you talked a lot about what to eat. What are some of the ideal situations to bring inflammation down? The other topic that comes up a lot is how we should eat. There's all this phase on intermittent fasting and calorie restriction and true fasting. We have a short webinar today, but can you comment a little bit about how eating is also as important as what we eat?
So there's what to eat, there's when to eat, right? There's what to eat with what. So what you're talking about is this emerging understanding that our bodies need a rest from food during the day, whether it's 12 hours, 14 hours, 16 hours, in order to heal, repair, and regenerate. If you're eating all the time, your body's just busy working and it can't actually kick in its reparative mechanisms. And that's really, really important. So I think, and I'll get into that in a second. The other thing that's really important to remember is if you focus on what you're eating, you don't have to worry about how much. People think we gain weight by overeating. It's not true. We actually gain weight by being overweight. So in other words, we overeat because we have an abnormal metabolic process going on in our belly fat. So visceral fat, belly fat, is the problem. And when you eat starch and sugar, you preferentially store it in your belly. And you don't even have to be that overweight, but that can create basically an inflammation factory. And the reason we're seeing, for example, all the COVID patients who are really getting sick and dying, being obese or having metabolic issues, is they have tons of this visceral fat, and that produces these cytokines. You've heard of cytokine storms and all that. Like one of them is called interleukin-6, and that is really high in these patients. Fat cells actually make these immune molecules, which is amazing. So you got to get rid of that in order to get healthy. So that's really important to cut out the starch and sugar for that. So if you focus on eating whole, healthy, nutrient-dense food, you're not going to eat as much. You're going to lose weight. You're going to feel better, and that's really important. In terms of the timing of eating, there's a couple of key processes that happen that are sort of meta processes in the body that regulate aging and regulate inflammation, regulate oxidative stress, regulate mitochondrial function, which is the energy factories in your cells. And there's a number of genes that are involved, like mTOR and pathways like mTOR and FOXO and DAF2 and sirtuins and all these fancy names that essentially are these regulatory pathways. And sugar and starch really screw them up. But if you really want to activate them to repair and heal and really reverse aging, you can use various techniques, whether it's a simple 12-hour fast, which it shouldn't even be called a fast, it's called breakfast, right? If you eat dinner at 6 and you have breakfast at 6, that's a 12-hour fast, right? If you eat dinner at 6, you eat breakfast at 8, that's a 14-hour fast. And if you do it at 10, that's a 16-hour fast. So it's not that hard, but that time of not snacking, not eating, actually allows your body to kick in a whole system of repair that activates stem cells, that reduces inflammation, that increases antioxidant enzymes, that builds muscle, that increases bone density, increases cognitive function, and that causes something called autophagy. Autophagy is essentially this process by which you think of it as a recycling system in your body that recycles and cleans up old cells and old parts and makes them into parts and then builds new cells. And there's also mitophagy, which is the same thing that happens in your mitochondria. The intermittent fasting, which is essentially like skipping a day of eating a week, or 3-day fast, or time restricted eating, or we call ketogenic diets, which is basically not eating carbohydrate and mostly fat, or we call fasting mimicking diets that Walter Longo was pioneered, who's an aging researcher. Those are like 800 calories a day for 5 days. It just kicks in these natural mechanisms we have to repair and heal. I mean, the body is so amazing, right? I mean, like nature heals. You know, Dr. Hartle operated my back, but then it got better. Like the healing system, when you cut yourself, is there designed to repair and heal. The problem is when you eat all the time and you don't give your body a break, you're inhibiting these systems. So it's really important. And also, I don't know if I told you, but I fasted like for 48 hours around my surgery, because when you fast around surgery, it actually helps these systems to kick in here and repair. Although the breakfast I got was pretty terrible after I woke up. I did not. I honestly,
I remember. I remember you.
I didn't say anything about the hospital.
You
but
posted it.
Oh my God, I got in so much trouble for that. But anyway, so it was like how did I woke up? I woke up to orange juice. I woke up to high fructose corn syrup. I woke up to like French toast and like cereal and all this like sugar and starch for breakfast.
Mark, a lot of questions coming in, and I'm just going to pick one of them. One of the first questions was, how long, if somebody follows your advice, how long does it take to see results? And I know from, and another question was, do you have a list of books? Of course, there's a great book. I mean, I've been using this book here recently, where everything that we talk about pretty much, I think, is summarized, and you have 13 more books that people can pick up. So, but I was wondering, the one thing that I found really interesting was that you tell patients or clients or patients, you tell them to experiment a little bit, to try things for a certain time period, and then so how long should they try, and then how does that process, the back and forth, go until people come up like with their own version of your diet?
Yeah, I mean, I think, the personalization is important. We can talk about that, but it's amazing how fast food works, like really fast. I'll just tell you a quick story of a patient, and I'll give you some more examples, but I had a patient come into Cleveland Clinic who was a body mass index of 43, which is massive. It's called severe obesity, over 30s obese, 40s severe obesity, very big lady. She was 65. She'd had a couple of stents, heart disease, she had heart failure. His kidneys were failing, liver was failing, fatty liver, high blood pressure, lots of medications, and just on her way out, right? She was on her way to a heart transplant, a kidney transplant. 3 days of changing her diet, and she was diabetic. She was on insulin, injections, and medications. 3 days, she was off her insulin. 3 months, her A1C, which is her blood sugar, went from 11 to 5.5, which is, when you get a 1 point drop with a drug, it's like a miracle drug, right? And it went down by 6 points. She normalized her liver function, her kidney function, her ejection fraction, which was her heart pumping ability, went from like 30 something to 50, which was normal. And she got off all her medications in 3 months, lost 43 pounds. So we never see those kinds of results with traditional medical care because we're not dealing with the root cause. So for her cause was she grew up on junk food her whole life, and that was all she ate and all she knew. and swapping it out was a miracle. So we've also done programs with people we call Growing a New Body. I've written a book called The 10-Day Detox Diet. And if you take people for 10 days and you put them on this kind of eating, you get them off the junk, eat real food, get rid of all the inflammatory food, add in all the anti-inflammatory food. In 10 days, we see remarkable results. We see, we do questionnaires in medicine. We have something called review of systems, which is basically asking you about every symptom you have and every part of your body. And then we kind of look at it, but we do a quantitative one where we score it like a 1, 0 to 4. And then we do it at the beginning of the week and at the end of the week. In 1 week of doing this diet in a group, we do it in a group setting, 70% reduction across the board, all symptoms, all patients, all diseases. So you have migraines, you have irritable bowel, you have joint pain, you have this, you have that. It's just dramatically better. And then the average weight loss is about 10 pounds. The average blood pressure drops about 15 points. The average blood sugar drop is about 20 points. So it's pretty impressive when you start to see how powerful food is and how quickly it works. So I always encourage people to do an experiment and try a more aggressive approach. Because if you're drinking like a case of Coke and then you go down to 6 Cokes, all right, it's better, but your mouth won't see much difference. But if you really radically change your diet in a short period of time, you can see what your symptoms, what degree your symptoms are related to what you're eating. Now, sometimes it's not what you're eating, right? Like when I was eating healthy, but I still had back problem because I did stupid thing with my back. But I think it's really amazing when you see how quickly food can make a difference. So then you get to say, okay, I'm going to do this for 10 days. And then you start adding stuff back. You go, oh, gee, when I eat the dairy, I got stomach ache, or when I eat gluten, I got a headache, or, you just kind of start to learn about what's going on with your body and personalize it.
Mark, I know Ricky has a lot of questions and comments as well, but I have one more question. I'm a simple surgeon. I go to work early in the morning, and then and it's very hard in the hospital to find good food. I'm blessed because I have a beautiful Turkish fiance who usually cooks. She prepares things, but she's away now for a week. And it's a real struggle because I say this jokingly, but it is true, because I just don't know what to eat, because I'm reading your book and then I'm walking by the deli, I'm walking by the restaurant, and I'm sure a lot of people have the same problem. You go to a restaurant, you're trying to pick up food. How do you know? Is there like an app that you can use to scan the food and you pick up the healthy food, or how can a normal person figure out exactly what's good, what's bad, and how to select from the incredible variety of food offerings?
Well, there's sort of two questions there. What do you do to not be in a food emergency, and how do you sort of overall pick your diet when you're out and about? Because I know if you're in a situation where you're in a food wasteland like the hospital, then you have to plan ahead and bring food with you or get it delivered. I have a whole emergency food packet at Cleveland Clinic, for example. There's some food you can navigate there and hunting together, but I have my drawer stacked with nuts and with canned salmon and with grass-fed beef jerky and basically high protein and fat foods where I can quickly get something and I can not be in trouble. And I might not have a beautiful meal, but at least I'm not going to be poisoning myself. And when you're out and about, I think you just have to ask yourself a simple question, which is, my joke is when I used to teach, do a lot of work with churches, and I would say it's really simple to figure out what to eat. Ask yourself a simple question: did God make this, or did man make this? Right? If you look at an apple, okay, well, that God made that. If you look at a Twinkie, well, no, was not made by God. So it's a pretty simple, like, binary choice. So how far from the original food's form is what you're eating? Like if you're eating, a broccoli, it's just broccoli. If you're eating a piece of chicken, it's just a piece of chicken. So just eat food that you recognize that's actually real food. And it may not be organic, it may not be perfect, whatever, but if you're out and about, that's what I choose. And then I stay away from the bread, I stay away from the desserts and sugar, I stay away from the sugar sweetened drinks. I mean, if people listening can do one thing, it's get off of sugar sweetened drinks, like whether it's sodas, energy drinks, sweetened coffees, sweetened teas, anything like that. It's just, that is the worst thing you can do for your health, because it's just like mainlining sugar in your bloodstream and cause your liver to get fatty and drive all this inflammation, and most of it's high fructose corn syrup. So it's really important to get rid of that. But when you're out and about, you just have to actually think about the quality of the food and how can you get close to and as nature as possible.
I think that's great advice. Yeah.
In addition to, the spine degenerative conditions we treat here, we're part of largely the Brain and Spine Center here at Weill Cornell. So there are other conditions like multiple sclerosis and Alzheimer's. And, I was reading someone even called one of these neurodegenerative conditions diabetes type 3. I don't know if you're familiar with someone blogging about that or saying that.
For sure.
And how inflammation is part of the problem. What have you seen in your research and your interaction with patients and clients on how food can mitigate some of the symptoms from, Alzheimer's, Parkinson's, MS, things like that?
Yeah, I mean, we're talking about, the spine and we're talking about neurology, but the truth is that all these diseases of aging are inflammation diseases: heart disease, cancer, diabetes, Alzheimer's, Parkinson's, MS, autoimmune disease, right? So what's driving the inflammation? In medicine, we just stop. We go, oh, this is an inflammatory disease. Let's give you an anti-inflammatory. Let's give you an immune suppressant. It can be helpful, but it doesn't solve the underlying issue. So, for example, with MS, I don't know if you're familiar with Terry Walls. There's a friend of mine. She's on our faculty at the Institute for Functional Medicine. She's an MD who was in a wheelchair with progressive MS and wasn't able to function. And she decided she was going to try some of the functional medicine nutritional principles and ended up, focusing on an extremely nutrient-dense diet. So she eats organ meats, which are the most nutrient-dense meats. She eats tons of mushrooms and tons of greens and tons of phytochemicals and mostly what we call paleo-ish diet. And she's completely reversed her MS. She's off her medication. She rides her bike 20 miles a day. And she's created incredible clinics at the VA. She works at the VA. She's done published research showing the benefits of this approach in MS. So it really works. With Alzheimer's, again, that's an inflammatory disease of the brain as well. And the question is, what's causing it? Well, for subset, Alzheimer's is not one condition, right? There's many types of dementia that are Alzheimer's. It can be caused by many factors, such as insulin resistance, toxins, and so forth, nutritional factors. But a lot of it's caused by what we call insulin resistance to the brain or type 3 diabetes. And so essentially think of it like diabetes of the brain. and it's because we're eating all this sugar and starch. And I've had Alzheimer's patients and put them on a ketogenic diet, which essentially eliminates carbohydrates for the most part. And they actually come back to life. It's quite striking. I've done this with autistic patients. So whether you have, Parkinson's, Alzheimer's, MS, these are all inflammatory issues. Autism is an inflammatory disease of the brain. ADD is inflammation. Depression is inflammation in the brain. So you have to always ask what's upstream causing the inflammation, right? Is it food? Is it a toxin? Is it an allergen? Is it your gut microbiome? Is it an infection? Stress? Is it poor diet? Like what is it? So that's really what functional medicine does. It really looks at the body as a system. And if you create health, it actually helps the body to resist disease. So I think when I talk about functional medicine, it's really a model that looks at the body as an ecosystem, as opposed to all these different parts, that everything is connected. And that if you get to the root causes and create health, then you don't really need to treat all the diseases separately. They just go away as a side effect of creating health.
That's great.
Maybe a few words, Mark. There were some questions about how this most specifically relates to spine. Is there direct? There's one condition as a surgeon that I'm very well aware of is epidural lipomatosis. That is fat tissue inside the spinal canal that can cause severe nerve compression. And there's actually the number one treatment for that is really weight loss. People lose weight, and the epidural lipomatosis, the fat tissue in the spinal canal, is reduced, and patients become symptom-free. So that's a really nice example of how dieting and nutrition can directly affect a spinal disease. But maybe from your and also Ricky's perspective, what are some of the more direct connections between nutrition, exercise, and spine-related disease?
Yeah, I'll take a stab at it first, and then I'll have Mark help me out a little bit. What you said, number one, is weight. We know that for every pound extra in your belly is almost 7 to 10 pounds on each of your discs. So even if you have 5 to 10 pounds to lose, we're talking about 50 to 100 pounds extra on your spine. So that type of weight loss will certainly have a direct benefit to your back. The other thing is, when we talk about disc degeneration and facet joints, so the small little joints of your spine having inflammation, it's a balance between anabolism and catabolism. Anabolism is growth and repair, and catabolism is destruction. And we know that in the disc specifically, if you have a lot of inflammation, a lot of cytokines, Mark was talking about the cytokine storm. If you have a lot of those circulating in your body, you are going to degenerate your discs, which is why we all shrink with time, right? Those juicy discs in our spine were plums, and now they're prunes because they're getting smaller. So just by decreasing the overall inflammatory state of your body, you'll probably prevent some degeneration. Not all of it is going to be cured by diet. Some of it does require interventions and therapy and sometimes surgery, but overall that will help the functional status of the spine.
I think you're right. I think people need to understand that their structure is so important, and it's determined by what you put in your body. What are you made of? Like, you're made of all this stuff you put in your mouth. And if you don't connect the dots on that, you often will miss the boat. And I think what Ricky said is so important about inflammation, that it's not just like your joints inflamed, but you're swimming in a sea of inflammation. It's this silent, hidden inflammation. You don't feel it, you don't see it, but it's just there because of this poor metabolic health, which, by the way, affects 88% of Americans. So only 12% of us are metabolically healthy. The rest of us are not, to some degree. And so upgrading your diet by using an anti-inflammatory approach that we talked about is a huge way to reduce pain and to actually help. Also, building the right kinds of structure in your body through the right kinds of muscle building nutrients, amino acids, protein, so forth, is critical, and combining that with exercise. So when you combine the exercise and the food, and this is sort of what I learned with all my back issues, was really, it wasn't just the food. I had to actually also use a physical therapy and training program to build up the muscles that were weak and unload the muscles that were overdoing it, that causing all the issues. And combining those things is so powerful. So, the inflammatory nature of our diet is driving many things, and the spine issues are huge.
Mark, let's talk a little bit about fun stuff. We did a Spine Time webinar a few months ago about spine and wine. There are some questions about wine. I know you've got some specific recommendations or opinions about that. Maybe wine, and then also talk a little bit about bread, because you mentioned the good German bread, but those are, again, things that everybody's probably wondering, what can they do? What should they do? What should they avoid?
Yeah. So alcohol, is kind of one of those mixed bags, because it's a poison, and the dose makes the poison, as Paracelsus said. Wine and other alcohols, have sugar, and they can, when you can overconsume them, cause all kinds of issues with gut microbiome, with fatty liver, with inflammation in the body. It seems like a little bit sometimes is the opposite. A little bit can be helping with inflammation and actually be good for you, but there's really mixed data on it. You look at these large population studies, these cancer risks. So we still don't know. And there are many cultures, like I just got back from Sardinia this summer, where they look to be the longest of any populations, that they have the longest lived males in the world, and they drink wine every day. So, but if they have Cornell wine, which is a special wine, there's no sulfites, no preservatives, it's got super high level of certain antioxidants, and they don't overdo it. So I think there's a real kind of fine line. And what was the second part of your question? I forget.
The bread.
Oh, the bread.
So how many glasses of red wine? How many? What do you think is reasonable?
I think everybody's different. I personally have gotten drinking less and less and less because I feel better and better. And I got an Oura ring, and then when I drink, I'm like, wow, my sleep is so screwed up. Like, I can see on my sort of biometrics how alcohol causes me to have poor quality sleep and lower heart rate variability. My heart rate doesn't lower. It just interrupts quality sleep. But in terms of the bread, part, the truth is that it's not that grains are bad. It's that the grains that we're eating are pretty bad in America. The white flour, it's dwarf wheat with all the problems that I said. So I encourage people to try experiment with different kinds of breads. For example, in some of my books and the Food with Things I Cook, there's all kinds of nut seed breads. The German bread, you can get those. You can get the rye bread. It's in America, but it's in this package. It's fine. You can toast it. It's good. I encourage people to use that. It's not like the German bread. I don't know why nobody in America has actually opened a German bakery. It's like where they make that kind of bread. It's like it seems like a no-brainer to me. But I would stick to weird grains, more heirloom grains, strange grains that you can make food from. And also, there's a great product that I like, and I don't have any affiliation with it or anything, but it's called Lynn's Life, Lynn Life, Lynn's Life bread. And essentially it's made from pumpkin seeds, chia seeds, flax seeds, psyllium husk. You add in egg whites and a little almond milk and some olive oil, You mix it all together, and lemon juice, you throw it in the oven for 90 minutes, and you get this soft, fluffy, really delicious bread that you can toast and put stuff on. It's really yummy, and it's just fiber, fat, and protein. There's no carbohydrates in it. It's really amazing. And so there's all kinds of ways to kind of hack bread, but I think, you know, basically bread and sugar sweetened beverages are the culprits. Most of what's wrong with our health in America and most of the healthcare costs.
Well, Mark, this was a great 45 minutes that we had. I think we have to wrap it up. I'll let Ricky say a few words at the end, but I just want to reassure you that once Ricky and myself and the other doctors, once we've cured spine disease, our exit strategy is going to be a German bread store on the Upper East Side. So we'll have you come over then. So Ricky, do you want to say a few words to finish up?
Sure. Yeah, great. You know, Dr. Hyman, this was a pleasure. Definitely enlightened us on a lot of the things that we read about on the internet or hear about, and some are fads, some are real. But I think the number one takeaway for me was it's more important about what we eat and not necessarily how we eat. You know, the intermittent fasting and the caloric restriction are great, but if we put in good whole foods, high quality nutrients into our body, we're going to bring that inflammatory state down and probably help with a lot of the modifiable risk factors that a lot of our patients, you know, even ourselves complain of. So I really appreciate that. And, you know, great questions coming into the chat from a lot of our patients. A lot of the stuff you can find in Dr. Hyman's books, many of them, like I said, What the Heck Do I Eat? Eat Thin, Eat Fat, Get Thin. That was a great book I read about avocado oil and things like that. So please check those out. And I agree with you. It's you know, the whole political conversation we can have is, you know, why is it more difficult to get whole foods? You know, getting a nice salad here in New York is $22, but getting something inexpensive and is usually unhealthy. That's a political conversation for the next time. But I think just finding what resembles its natural state is probably the best advice you gave us, and I appreciate that.
Yeah, leave the food that man made, eat the food that God made, pretty much. Even a kindergartner can understand that.
That's a good one. Mark, do you have a website that you direct people
yes, drhyman.com. Instagram is also Dr. Mark Hyman, and Facebook and all that. So there's plenty of content. It's free, most of it. Enjoy. Podcast, Doctor's Pharmacy. You can go listen to that. There's hundreds of episodes. So you can, if you want to care about any issue, Google Hyman and whatever the topic is, and I probably wrote about it over the last 25 years. So,
well, okay, Mark, we'll let you go back to I guess you're surfing. All right, perfect. So be careful. Don't hurt your back. And Ricky, thank you so much. Thanks, Roseanne, Sue, and the others.
Everybody. Thank you.
For putting this together, and have a good night. Bye-bye.
Thanks, guys. Take care, everyone.
Thanks, everybody at home.
Good night.
Bye.
That was fun.
Yeah.
There's a lot of